Hey, this is Russ. Notice anything different today? I'm not going to tell you what the difference is. You should notice it right away if you're a normal Russ is Right viewer. All right. Anyways, today I have updates for patient 13M from the UK. Remember him? We just talked about him earlier this week. And then I have a new patient for you too. So let me give you the updates for patient 13M. Now, he wrote to me again to clarify some of the things that I didn't understand because I have poor understanding of English as a language. And so he clarified some things. And also patient 9M chimed in too. He did a little research to help try to clarify it for me. So patient 13M mentioned something about his femur being broken. Remember that? I'll show you a picture here. Yeah, this is pretty dramatic. Yeah, so if you look at the before and after, there's a big break right there. So this is what happened to him. And we mentioned the term being nailed. Remember that? And I didn't know what he meant by that. So and again, I'm looking off camera here. According to patient 9M, he said that nail is another term for a rod or a pin. Okay, so if you take a look at the photo here, you can see there's a long rod inserted in the femur, and then it's been pinned in or nailed in. Okay, so yeah, it was pretty much what I thought it was, but again, not knowing 100%, hearing it in that terminology before. Because some of the terminology, as you know, in the UK compared to US is different. Even though we all mean the same thing, we say things slightly different, okay? But yeah, that's pretty dramatic. I can just imagine how much that hurt. So I feel sorry for our patient 13M. He says, interestingly, the break of the femur was the single most largest incident for death from injury in World War II, because the fats from the bone gets into the bloodstream and causes a thing called fat embolism. And he knows this because this is what happened to him, and he was in intensive care for 2 weeks. Okay. So yeah, this is information I've never known about, but that's what happens. And he also sent me a message saying that he's very active, and his surgeon thinks that he should be able to get back into boxing. And he has an appointment on the 18th of this month. So good luck to him. All right. All right. I want to introduce a new patient for you. This is patient 14F from Indiana. All right. And she writes to me, she says, I am now a 64-year-old female who had both knees totally replaced last year, 8 weeks apart. Now that's tough. To me, that would be tough. I would not be able to do that. I wasn't even doing well after 3 or 4 months. All right, so she had two done. All right, she says this time frame was recommended by my surgeon, and so I decided to go with it because COVID had hit and I was off anyways. So she kind of did it out of convenience as well. She says, a bit of history. I have been a runner and have run many half marathons, 10Ks and 5Ks over the years. My last half marathon in 2009, my meniscus tore on my right knee at about mile 10. I did not have a repair and decided to just rest, recover, and do physical therapy. I did very well until arthritis began, and then by 2019, both knees were causing me constant pain, bone on bone, medically on both. So she has issues. Yeah, she's got to have to take care of that. She says, I had tried injections but got minimal pain relief. Since my health was good, I was on no medications and only slightly overweight. I decided to go ahead with the surgery. I had the right knee done at a wonderful surgery-only hospital, which made me feel safer, on May 27th, 2020. I stayed overnight and went home at noon the next day. The experience was great, and I was up and walking the hall with the walker and going to the bathroom same day as surgery. Yeah, I did too. They forced me to do it. Not that I really wanted to walk around, but they forced me. I was on pain meds and anti-nausea medication because they had made me so sick. Physical therapy started 2 days later at home, and all went really well. So I took 12 weeks of FMLA just to give me security in my job and scheduled my next appointment surgery for July 22nd, 2020. The second knee hospital experience was the same as the first, But once home, everything was harder because my right knee was still healing. Yeah, this is the fear that I have about getting two done so close together, because I've always felt that I wanted to have a stronger on one knee that's already been operated before doing the second knee. But she did it within a couple of months. Okay, so she says it was harder because it was still healing. Left knee was far more swollen, stiff, and bruised. Still, I pressed on. Keep in mind that I continued pain meds through this entire time. Yes, I cut way back, then increased to full dose again after second knee. I had to eat tons of fruits, vegetables, salads, and stool softeners, plus lots of water the entire time, which wasn't hard for me because I'm a vegetarian. Okay, I'm walking unassisted now, no cane, no walker. Oh, good for her. Steps still hurt a bit, but I'm doing them, and I take Tylenol after my long walks. My incision was closed with a zip line. Yeah, do you know these zip lines are interesting? Every time I see one of these, I like, yeah, how does this work? Okay. She says it was closed with a zip line. This was amazing, and my scars both are minimal. Yeah, I think it actually looks pretty good. She's doing pretty good there. This thing was removed by PT at 3 weeks post-op and came off easy like a Band-Aid. Yeah, they kind of look like Band-Aids, right? Okay, she says, I would do it again in a minute. I can now go shopping to the grocery stores and be on my legs for long periods of time pain-free. I stretch and walk daily. My only issue is numbness on both knees and some pain on the head of the fibula, which is the outside of the knee. I can live with that. Attitude and research, in my opinion, is key to speedy recovery. However, we all have different pain tolerance. I pushed through the pain and took pain meds like a champion. I don't regret it. So good for her. She's doing pretty good. And 2 knees again. So, for those of us who only did 1 and we're still suffering with the 1, we can't understand how anyone could do 2 at one, within reasonable time, right? But yeah, here's another one, 2 knees, 2 months apart, and she's doing well. So good for her. Anyways, this is our last knee patient so far. So if you would like to join in and tell us your story, just send me an email at contactrussisright@gmail.com. Okay, let me clarify this. If you send it to russisright@gmail.com, it is going to another guy. All right. And we know that because some of these emails have gone off to another guy, and he's been wondering why people are sending him knee photos. All right. This is why my email address is one long word, contactrussisright@gmail.com. Okay. So just send me photos of your knee. Tell me your age, the gender, where you're located. If you're in the U.S., what state you're located. If you're in a different country, what country you're in. Okay, and then your story, and then every now and then, give us some updates as to how you're doing. Okay. Anyways, I appreciate everybody joining in and giving me some things to read on camera here, and hopefully we'll get a few more. If you like the video, go ahead and hit that like button, hit the subscribe button, and I will talk to you guys next time.